Dear viewers, welcome to the third Straumann live session from the EAO 2019 Congress in Lisbon. As always, I'm having another exciting guest today with me in the studio, and this is Professor Filippo Graziani. Welcome to the studio, Filippo.
Thank you. Good morning.
Filippo is a professor of periodontology at the University of Pisa, but he's also an honorary professor at the Hong Kong University and at UCL, University College in London. And Filippo is, of course, the current president of the European Federation of Periodontology, EPF. And, you know, so much experience, Filippo. So much to talk about, so much periodontology, finally in the studio. I'm really looking forward to our conversation. Thank you very much for coming.
Thank you for the invitation.
My name is Michel Molan. I'm head of the clinical operations team at the Straumann headquarters in Basel, and I'm very happy to be your host again. So, Filippo, let's get started. Maybe just a first question about how do you feel at an implantology congress as a periodontologist when you walk around here, when you see all the implants, all the teeth removed? How does that feel?
Well, that's a very difficult question if you want me to be political. But of course, you know, I value very much implant treatment is one of the key issues of the armamentarium of a periodontist as well. Of course, when it's about replacing teeth that were already lost. When it's coming to taking a tooth out to place an implant, that's a different story. But of course, sometimes this is what it has to be done. And of course, implants are one of the best possible options.
Right. So then really let's speak about how to save teeth. And you did a lot in that. But before we start, I would like to mention, of course, that you have worked a lot with Straumann Emdogain, our long-term biologics that help periodontologists in their treatments. So can you give us a little update on what defects, what situations you are using Emdogain in your daily clinical practice?
Well, as you know, the path to save teeth is rather complex and it takes time, but usually it starts with trying to understand and changing the habits of the patient in terms of cleaning, smoking, and so forth. Then there is always an unsurgical phase, which can be even sometimes enough to, let's say, solve the first part of the treatment. And then for some patients, we have to rely on surgical treatment of periodontitis. Now, when it comes to surgery, in my, let's say, clinical routine, the amylogenins, the Emdogain, is really one of the key device that I have in the, let's say, in my armamentarium. Reason being are really two. On one end, it's the clinical feasibility. It's something that is pretty easy to apply, so it allows me to save time, and every time that I'm cleaning a defect, you know, surgically, then the moment that I have to apply the regeneration, so the device itself is no longer than a few minutes. So that's surely something that is relevant. And on the other hand, which I think is something that is not focused enough, is the fact that we have evidence that the application of Emdogain is not just related to intrabony defect, but also to suprabony, namely the horizontal defect, which are extremely challenging when it comes to be treated, and also for cation. So I think it's the fact that the material is very flexible in a way that I can use it for all defects that makes it something that is important to have in my routine practice.
Right. And now we have just added a new chapter to the history of Emdogain, in my opinion, by looking at more minimally invasive, non-surgical applications of Emdogain. You have just published a clinical study about Flapless application of Emdogain. Can you explain the viewers a little bit what the study was about and what the main question of that study was?
Yes. The application of the Emdogain FL wasn't as an alternative to the surgery. So we're talking about, that's why I started making the various phases of treatment. We're talking about the phases that actually is preceding the surgical application, which is the non-surgical treatment, which is a treatment that every subject affected by periodontitis will get. So what actually we did was to try to see whether in deep pockets that were at least 6 millimeters, the non-surgical application of Emdogain would result in a better clinical healing. And therefore, what we did was to try to use Emdogain, and that is, I think, the main difference with some previous report, as an application of the conventional non-surgical treatment, yet performed in a very specific way and in deep pockets especially.
Right. So, and what was your focus on this study? Because you were actually testing very early as 1 day after the treatment. What were you looking for?
Well, basically, we just didn't look at the clinical healing from a periodontal standpoint, but we also checked the systemic health and especially the systemic inflammation. Now, systemic inflammation is crucial and is a great deal of the part of the research activity of my group. As we know nowadays that systemic inflammation is conducive, for example, to cardiovascular diseases and other chronic comorbidities such as diabetes, obesity, and so forth. So the capability to control systemic inflammation is actually crucial in chronic diseases. Now, when it comes to systemic inflammation, we know that, for example, non-surgical periodontal treatment as well as surgical periodontal treatment do trigger peaks of systemic inflammation in the first hours after treatment. Now, what is behind these peaks is something that is not yet clear, but to give you an idea, in the latest consensus that we run as European Federation of Perio and the World Art Federation, we clearly stated that we should try always to use, especially with subjects with comorbidities, treatments that are not determining peaks of systemic inflammation, which might pose a risk of cardiovascular acute infarction, for example, to subjects with disease. Once again, this is not something measured. We have some reports on large scale, for example, insurance data, because periodontal treatment is surely safe, but at the same time, we suggest caution in subjects with comorbidities in terms of altering inflammation. That's why it's important.
Right. So now, coming back to the study and also with relation to what you just said about this inflammatory peak very early after the surgery, what were the outcomes that you have achieved when you applied Emdogain?
Well, basically, in the test group, the one that was treated also with Emdogain, we could not witness such a tremendous peak of, for example, C-reactive protein, but especially there was no peak of D-dimer. Now, what is D-dimer? D-dimer is an effect of the fibrinolysis, so the degradation of fibrinogen, so it's very much linked to the coagulation. Now, what is normally happening, something that we measured many times, that after treatment, you have a peak of D-dimer as much as a peak of all the inflammatory markers. But when we applied Emdogain, there was no peak, and this difference was statistically significant. And what we believe, the only explanation that we might actually have for this, that most probably Emdogain has a sort of local anti-inflammatory effect, and this anti-inflammatory effect might ultimately work on the blood clot and the fibrinolysis. Would actually suggest in lay terms, and most probably the application of Emdogain makes the blood clot more stable.
Okay, I can see clearly a future topic for research here.
Yes, it is.
So I think we not get bored. Any word on the clinical outcomes of the study?
Sure, you know, what is happening is most probably as a companion findings, you know, we have blood clot that is more stable on one end, as witnessed by the dimer level that it just stays the same. We also get better periodontal healing, which most probably that is the reason of the blood clot. Now, the better periodontal clinical healing, I think, was mainly witnessed not just by the reduction of the deep pockets, but I think what was crucial was the number of cases that were so-called solved. When I say solved, I'm referring to cases that do not present residual deep pockets after treatment, therefore pockets that will not go for surgery. And the difference over there was huge. We're talking about the 10% versus the 40%. So it's 30% more. Basically, 40% of the subject treated with Emdogain didn't have to go for surgery afterwards.
Wow, that's quite a difference. Yeah.
Yes.
Thank you very much for explaining on your latest results. I know that there are even more later results coming. I know that you have always something up your sleeve. You're also working surgical, so do you want to use this chance to probably give an outlook on your latest surgical results with Emdogain?
So this is word prime view, eh? We can never,
sure.
We haven't shared to anybody. But basically, we also did the trial with the surgical application of Emdogain, basically opening a deep intrabone defect, and with or without Emdogain. And the group that actually was treated with regeneration showed an inferior level also of C-reactive protein. Okay. And this was dramatically significant. Namely, the non-surgical application was determining a lower systemic inflammation. Therefore, I think there is room to say that that could be very interesting to explore, for example, when doing surgery in subjects with comorbidities, whether it's diabetes, hypertension, or cardiovascular diseases.
Right. Thank you very much for that outlook. I'm really looking forward to see that article published.
Me too.
Let's go back to Flapless a little bit more. We have introduced a product not so long ago. It comes with a smaller needle, so to really make it perfectly adequate to treat these pockets non-surgically. But you know, what we've realized is also over the last couple of months that there are some critical voices, people that don't believe in this treatment method. So what would be your response if somebody is really critical if this works?
Well, I believe in numbers more than opinion. So the numbers that we found and the way we ran the study were pretty solid. But I think it's also important the way to apply it. I mean, it's easy, but people should not think that it's so easy. There are some steps that I think you should be taking into account. First of all, periodontal treatment has to be top-notch quality. Mm-hmm. Therefore, we're talking about being capable to reduce plaque control, talking with the patient, understand his needs, and performing a correct instrumentation. Then the instrumentation was always done under magnification, whether microscope or loops, and that also enhanced the healing of the treatment. And I think what is also crucial is that when you're applying Emdogain or this kind of fluid devices, your goal is to have the highest amount of surfaces that becomes wet and in touch with the material. And of course you have bleeding, which is one of the main enemies when you apply devices in surgery. But you see, you have bleeding even when you do surgery. So sometimes it's very tricky to control bleeding. What we did was to try to make this step approach. When we apply the pref gel, so the preparation for Emdogain, we press extremely robustly in order to dislocate the blood clot. Then we do suction, and then we apply it again. So to make sure that the root surface is in touch with the DTA enough. Then we leave it for 2 minutes, we clean it, we rinse it, and we also use again the ultrasounds to clean deep in the pockets. And then we apply some material to absorb the bleeding. We actually use superfloss, but I'm sure there might be some little gauze or something that it's enough to be left for 1 minute in the pockets, and it has to be 1 minute because you want not just to remove the bleeding, but to make sure that for a while you also contain the blood vessels. Then you remove the gauze or the superfloss, and then we apply once again with kind of a robust pressure the Emdogain on the root surface in case there is some chance of dislocation of blood. And that was it, to be honest. And that's what we did, just in deep pockets though. Okay. I don't see the need to do it in 4 or 5 millimeters pockets.
Right. And you know, how sustainable is this? Do you have any I mean, the paper goes as far as 3 months, if I remember correctly. Yes. What is your longer term experience? Are these cases stable?
Well, all the patients were followed for 12 months, to be honest. So we have the follow-up of 12 months, although yet it hasn't been published yet. And the results are pretty stable. But what actually is crucial of the stability of the results, I don't think is whether a material or any holy grail has been applied before. I think what is crucial is good plaque control, adherence to supportive treatment, and hopefully controlling smoking. And this is part of the team.
Right.
So once you achieve good results, it's important that the patient is followed up properly in a regular supportive periodontal treatment.
Now, taking this together, what you have just said with your practical tips about the application of Emdogain Flapless, would you think that this is also a suitable treatment procedure for somebody who is not a periodontist as experienced as you are? Can this be done by an oral hygienist, for example?
Well, I don't see any problem why it shouldn't be done. Because the critical bit, of course, is to perform a correct periodontal treatment, so a correct instrumentation of the root surface. Then the application of Emdogain will add something more, but it is not the critical passage of it. What is critical is that the patient is followed properly and is instrumented properly.
So thank you very much again for your elaborations on Emdogain Flapless. I would like to finish this with a more general question. something that we also think about internally. Emdogain has been on the market since more than 20 years now. What do you think is the future direction? Where has Emdogain still a potential to grow? What do you think?
Well, I think that, of course, if we have to take in mind that the surgical treatment most probably is only the 20% of the cases nowadays, because non-surgical treatment is extremely effective. By changing the topic, the focus from surgery to non-surgery, I think that what is opening now is a tremendous potential application. Of course, if further results will confirm the positive findings that we did find.
We're not running out of research questions. This I'm very sure. So, Filippo, let me say thank you very much for joining us here. I really enjoyed the conversation. And this is the last session of the Straumann Live here on stage from the EAO 2019 from Lisbon. So let me say thank you very much, dear viewers, for watching us. And I'm really going to miss this. Take care and goodbye.